Hello everyone, welcome to my presentation. This presentation is about design relevant factors affecting digital patient experience. Thanks for having me. I'm Tintin Wang, a PhD student from Delft University of Technology. I work on user-centered design for improving digital patient experience topic with Guido Ginti, Marek Melas, and Richard Yosens at the Faculty of Industrial Design Engineering. Guido is a postdoc, focuses on digital health design from medical background. Marek is an associate professor of teamwork design in care networks. Richard is a professor of physical economics and works on the convergence of healthcare technology and design. I'm glad to be here to represent them and share our research with you. In this presentation, I will introduce a little bit about the research background, methods, then dive into the results and discussion part. You may be curious about what does digital patient experience mean? In this study, it refers to the patient experience in digital health. Patient experience is defined as the sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. And digital health refers to the systematic application of information and communication technology, computer science, and data to support informed decision-making by individuals, the healthy workforce, and healthy systems, to strengthen resilience to disease and improve health and wellness. Digital health interventions, patient experience, user experience, patient-centered care, as well as user-centered design are the main research area of this study. Accelerated by COVID-19, there has been a significant increase in the adoption and use of information and communication technology that helps minimize hospital visits for patients with chronic disease. However, digital health interventions can empower patients and also alter their overall healthcare experience. Some patients even see digital health as a burden or as interfering with their relationship with care providers. It is therefore important to further address how the design of new technologies affect digital patient experience. There is a need to identify facilitators of and barriers to influencing digital patient experience, and to design appropriate new interventions. The research aim of this study is to understand the digital patient experience by identifying its design-relevant influencing factors. And the research question is what design-relevant factors, including methods and strategies, are described in the literature that impact patient experience in digital health. To answer the research question, we performed an umbrella systematic review, which is a systematic review of multi-reviews. We followed the Prisma methodology and searched the reviews from Scopus, PubMed, and Web of Science. 2 round small random samples were independently reviewed by 2 researchers. Inter-rater reliability was assessed using Flacy-Cohen's coefficient. Collected data was thematically analyzed. The search resulted in a total of 115 reviews. Following the screening, 45 papers met the eligibility criteria, and 15 of them, representing 543 studies, were included in this paper for data extraction. They presented different types of findings, including themes, frameworks, models, methodologies, checklists, and descriptive information to describe user experience or perspectives in digital health or the general barriers and facilitators impacting patient experience or digital health adoption, and also design features or methods improving patient engagement. The identified types was directly given by the included reviews authors. One paper could provide more than one type of findings. Among the varied findings, we generated 4 main themes to summarize the design-relevant factors we identified. They were individual context, content of health interventions, technical issues, and design features. Each of them included several sub-themes. For example, we used the patient capability, opportunity, and motivation, which inspired by Combi model to further explain the individual context. Of them, capability refers to the psychological or physical ability of the patient to use digital health, such as patient's medical conditions, technical literacy, health literacy, or language literacy. Opportunity refers to whether the physical and social environment of the patients enable the patient to access digital health. For example, the cost of digital equipment, financial reimbursement, or a familiar and relaxing use environment. And motivation refers to the reflective and automatic mechanisms that impact patients' acceptability of digital health interventions. For instance, patients' strong desire to lose weight or gain knowledge can motivate them to use the digital health. Based on the generated themes, we produced a preliminary framework explaining the design-relevant factors that impact digital patient experience. This framework was inspired by user-centered design approach. Therefore, we put the individual context in the center of the framework. In other words, it is very important to consider patients' needs at first, including their opportunity to access digital health, their capability to use digital equipment, and their motivation to accept the health interventions. Since we focused on patients, it is important to keep in mind that patients' key need is to improve their health and wellness. Therefore, the content of the health interventions should be effective. Among the included reviews, many reviews indicated that evidence-based interventions or behavior change techniques can improve the effectiveness of the interventions. For example, without evidence-based items, doubts about the credibility, security, and accuracy of interventions can impact users' digital health intervention uptake. Besides, communication and social support are the most valued behavior change techniques among the included reviews. Digital health is not a new type of healthy care, but rather a new method for delivering already existing types of healthy care. Many reviews mentioned technical issue was one of the biggest challenges that impact the uptake and adoption of digital health. System integration or interoperability, equipment mobility, internet connectivity, or technical usability and credibility impacting patients' digital health intervention uptake. Collectively, patients also expressed worries about the operation of hardware, the usability of software, as well as the privacy and security issue of the data transformation or storage. After considering the channels to deliver healthy care, the ways to present healthy information and guide patients to interact with the system efficiently, also very important, since the design feature normally impact patients' first impression of digital health. To align with individual context, healthy interventions, and technical issues, design features were relevant to personalized design, information design, navigation design, and visual design. They were also aligned with user experience design elements. Besides, a user-centered design approach, including designing core interaction features, has the capability to facilitate and enhance a positive patient experience in digital health. Knowing how to evaluate digital patient experience is very important. By evaluating patients' accessibility, usability, and acceptability of digital health can help to identify how digital patient experience was influenced by different design-relevant factors. As we explained, this preliminary framework provides an overview of design-relevant factors that impact digital patient experience. To our knowledge, there was only one previous umbrella review investigated the topic relevant to patient experience in telemedicine, while only providing limited information on digital patient experience and overlooking a design perspective. We believe our preliminary framework provides designers with an impression of which design-relevant factors impact the digital patient experience, and also provides guidelines to addressing them in the design process. There were two main limitations of this study. One is the relevant original studies may have been excluded due to our focus on review papers only. However, our approach on conducting an umbrella review provides readers with a quick overview of relevant digital patient experience studies. Another one is the differences in data collection and analysis in the selected reviews was not fully discussed, and we will address this issue in our further research. The design context of digital health is very complex. It involves multi-stakeholders and multidisciplinary knowledge. We believe it is vital to provide designers an overview of the potential influencing factors that impact the digital patient experience, not only from design perspective, and we also believe knowing how to evaluate the digital patient experience is a key step to help designers improve digital patient experience. Therefore, for the further research, we will present the whole findings among the 45 reviews we collected, including other influencing factors, evaluation indicators, and evaluation methods. We consider to submit the full paper within this year. We also suggest to identify which factors have the most impact on digital patient experience and to explore how user-centered design approaches enhance digital patient experience. We hope to address these two issues in our further studies. All in all, we generated 4 themes and several sub-themes of design-relevant influencing factors that impact digital patient experience, including individual context, content of health interventions, technical issues, design features, and we also found these factors align with user experience design elements, including personalized design, information design, navigation design, and visual design. In the end of this presentation, we want to thank China Scholarship Council. This work was supported by them. If you are interested in this topic or have further questions, welcome to contact us. We are looking forward to having a further discussion with you. Thanks.